So it looks like so far we have a pretty even mix of staff and volunteers, and wow, only one person said that Family First is their second language. We have about half in the somewhat familiar and about half in the new to me category. So that's going to be interesting, John.
Well, that was me who said it was second language.
Oh. That's good. Our presenter is prepared.
So you're training us.
Okay, we're just going to give everyone a couple more minutes. I see some more people coming in from the waiting room. If you want to, you can also feel free to put in the chat your name, your program, if you feel inclined. Thanks for doing the chat or posting in the chat if you feel like it, your name and your program, and taking the poll. And yeah, Jenny will have you do the introduction in a couple more minutes. I still see quite a few people streaming in from the waiting room and getting their audio and everything set up. And it's just 12 o'clock now. And we have Boulder, an intern, Bryn, the director of CASA of the Southwest. Oh, we'll let these last people get their sound together and then we'll have Jenny do an introduction. But we are at 50% CASA volunteer, 43% staff, 7% other. Hopefully you put your, let us know who you were in the chat. And we have 41% who are new to Family First, 55 are somewhat familiar, so pretty split. And then we had one more person, so we have 2 total who say they're an expert in Family First. So we have a lot to learn from you today, John. And I think Jenny Bender, our Colorado CASA Executive Director, is going to kick this off.
Yes, thank you so much, Lily. Well, welcome and thank you for joining our CASA network across Colorado. Welcome to our February monthly statewide Lunch and Learn hosted by Colorado CASA. I'm Jenny Bender. I'm one of the team members here at our state organization. I'm the executive director of the state organization, Colorado CASA, and we're an association of 18 local CASA programs throughout the state. Together in 2020, over 2,200 CASA volunteers fiercely advocated for over 4,500 children in Colorado. And despite the pandemic and the many operational challenges we all faced last year, collectively, it was a year of growth for CASA. We grew in number of volunteers by 16% over 2019. And this means now more than ever, when children desperately need a CASA volunteer, they are able to receive that. There's volunteers ready for their assignments. So each month since April, we've been conducting relevant continuing education trainings for our network. They have seemed to be really, we've received positive feedback and they've seemed to be popular. We hope you're enjoying these. The topics that have flowed so far have been pretty organic, but these will be recorded and posted on our website, coloradocasa.org. So stay tuned for a calendar of future 2021 events as well. We're especially excited about today's topic, but before we welcome our speaker, I want to thank one of our team members, Lily Sussman, for helping organize these continuing education trainings. got a little bit of background noise here. Got some teenagers e-learning today here at home. Sorry about that. And feel free to put your questions in the chat box. I want to thank our other team member, Tisa Kunke, for monitoring and mediating the chat. And we will have a hefty amount of question and answer time at the end. But as Family First is implemented nationally, many of us continue to have questions about the details of the act and how it's being implemented here in Colorado and how it will affect children and families and our CASA programs. While we definitely do not proclaim to have all the answers, we hope that you'll benefit from this training opportunity today. And we're excited to have our Family First expert from DHS help us train. The intention of this will just serve as an opportunity for us to raise questions and jointly consider additional information that we may need to be thinking about so that we can best work within and prepare for any changes. And it's my pleasure to introduce today's presenter, John Steinmetz. John is a training and development specialist serving as the Family First Prevention Services Act, FFPSA, and kinship liaison with the Colorado Department of Human Services and Organizational Support Unit Learning and Development Team. What a title. Evidence-based family therapy from a systemic and a strengths-focused approach, but also a multi-systematic therapy, MST approach, and substance abuse treatment for youth, MST substance abuse, and MST contingency management. John also serves as an MST BSF, MST CAN expert for substance abuse treatment for adults, and an MST Building Stronger Families and MST Child Abuse and Neglect Models. Quite the expert we have here with us, and we're really thankful for his rich background. John has a passion for seeing parents and children make healthy, positive choices that improve their lives for themselves and their future families. John and his wife, Christina, have 3 adult children, 2 daughters have families of their own, and a disabled son who lives with them. They also have an Australian Shepherd dog who loves them and has a wonderful plan for their lives. Sounds like we know who runs that house. John and Christina enjoy hiking, biking, skiing, camping in Colorado. John also enjoys hunting and gardening and making others feel better about their golf game. So again, I want to thank our team for helping us put this together, and thank you, John, for being our presenter today. Please feel free to put your questions in the chat box, and let's warmly welcome our speaker, John.
Well, good afternoon, and thanks for having me. Glad to be with you all. I know Tisa is going to be going through some slides that we've developed. I joined the state of Colorado last year in April, and we developed these slides as a presentation material to be able to give people an overview of Family First. So if you're hoping to get a better picture of what's going on with Family First, this is the place to be. So Tisa, are you able to project those? Good deal. And I'll be happy to field questions. I'm hoping to be able to go fairly high level on some of these things and plant a picture for you of what the overall theme of Family First is as an impression, because there's a lot of things, as Jenny was alluding to, and others who participate in work groups are aware that there's a lot of things still evolving, decisions still being made in the state of Colorado. Some other states have already implemented Family First. We're still in the process of getting our plan approved, and we'll talk about deadlines and timelines on some of those things. So let me move to the next slide and talk about, to give you the big picture. If one more slide there, Tisa. If you think about what casework in Colorado and around the country has been prior to Families First, frequently I would paint the picture that often families were seen sometimes as problematic for their children. So in abuse or neglect cases, if there's abuse or neglect that's occurred, the philosophy was that if we could get the child away from the source of the abuse, that was one of our interventions that might be the most effective at changing the problem. The data, though, that's emerged over time has proven that not only are families not the problem, and I think this would be true for many of the cases where you all have been advocates for the children, is you may work with them and see over time that you're protecting them from abuse or neglect incidents recurring. And then after they reach emancipation age, they find they go back to their family of origin and they regain that contact. And what they found is that's a common pattern around the country, and that kids being removed from their families still had the desire to be with their families, regardless of whether there was prior abuse or neglect behaviors that had occurred. And they also found that the separation from their family caused trauma for many children. So what you see now is a shift in the Family First Act saying, the data has proven to us that prevention is actually where we need to be spending our time, and seeing families, the strengths in families, as things we want to leverage in order to improve the outcomes for both the youth, the child, and the family. The next slide. Not going to say much here. This was signed into law back on February 9th, almost 3 years ago to, what was it, last week? It does make changes in the federal funding streams, specifically Title IV funds, and we'll say more about that as well. And this is where I want to leverage what I was starting to build the impression of in the second slide, is this is a major shift now, and it's a modernization and overhaul of child welfare practice, because what you're going to see coming out of this, the spirit of Family First was, rather than us trying to clean up trauma that's occurred as we've removed children from their families, what we want to do is re-envision the way that we're doing child welfare. And we want to change to providing preventative services to be able to keep the children together with the families. And in any instance where we are able to address the safety needs through prevention services and keep them in the home, we'd like to do so. So next slide. This is where what they decided to do is, rather than continuing to spend a lot of funding on removals where they would have the children placed outside the home, they want to focus on services that work. And that's why you see two words highlighted on this slide: evidence-based. We want to know that the services that we're funding are things that are known to work. And we want to make sure that they're trauma informed. They recognize what things are traumatic to developing children and what things are going to be healthiest for their development in long term. And that's why you see the subpoints of, we want services that aim to keep the family safely together. And we'd rather spend our money on the prevention services rather than on placement services. And because of that, it's not going to be income dependent anymore. Whereas previous funding, often that was one of the factors there. So then you see in the next slide, because of this, we are looking for a couple of things. In some instances with abuse or neglect, there may be the need for safety of the children that you do have to look at them being placed out of the home. But if we're going to do that, what they're looking for is, we want the least restrictive and we want the most family-like setting possible that we can achieve for that child. So as you'll hear as a theme as we go through these slides, frequently it's looking to explore all the extended kin to see, is there anybody in this child's life already where instead of removing them from family together, we can find something that's family-like and maintains those family relationships while still achieving the safety and the basic needs that we're trying to achieve for each child. And it's going to involve a comprehensive assessment. We'll talk more as we develop in further slides about the child and adolescent needs and strengths assessment, CANS, as some of you may have heard, that we're going to use when we're looking at removal from the home and some sort of placement, that it's really more of a focus on what are the services that we see emerge in this comprehensive assessment that identify the service configuration that we need in the new placement facility. The next slide, we're already well past the October 1st, 2019, when the first reimbursement became available to states that have already submitted their plan and been approved. And at this point, there's several states that are already have opted in to Family First. One of our neighboring states, Utah, has been a leader in this. There's, I believe, Kentucky and a few others. Arkansas have presented their plans. We have not yet opted in. There's some really good reasons for that. The plan has been submitted, and I think that's one of the things I want to be helpful to you with, giving you the status of where things are. Our plan was submitted, and we are actually, at least in our responding to the recommendations that they gave, the government gave to those plan submissions. It hasn't been signed, and it will be signed at the time when all the plan is approved and Colorado has determined that it really makes the best financial sense for us to go ahead and jump in. And I'll say more about those as we go. There's some Colorado core values that I'd like to move to in the next slides. This is a quote that Jerry Milner gave as he was talking about, if you want a thumbnail sketch of what we want to achieve in Family First, it's all about keeping families healthy, together, and strong. And this is where he was putting good words to what I've been developing as a theme, which is they want to re-envision child welfare across the whole US as a system that strengthens families' preventative care and breaks those harmful cycles that of trauma and family disruption that have occurred in the past when placement was seen as a primary intervention. And they'd rather do that than waiting until the children are hurt to respond. And this is really following the data. That was a quote from back in July of 2018 as this act was passed. If you move to the next slide, now we're going to start looking at the implementation of the act. And the next slide beyond this gets into what Colorado core values are. And one thing I'd like to highlight here is Colorado has already been making some significant moves in child welfare reform before Family First was even passed, the FFPSA, right? Because they have been looking to see some of these, you can see these 5 points here, family and youth voices being loudest heard, considered, and respected. They are, in many parts of the state, you already see systemic and community engaged integrated approaches to services to meet their needs. There have been shared accountability between the state and the counties in looking to make sure that we're integrating community of care that helps surround and support these families. And you can see in our policy and practice, we've been moving in the direction of using the scientific evidence to say what services do we know are evidence-based and effective. And there's already been a lot of work to strengthen and embrace natural supports. And I'll highlight some additional features to that as we go along. There have been a number of work groups, which you see in the next slide. This is just to give you a picture of the amount of thought that's gone into this. The state has been in leadership with this, but it's been very much a collaborative effort. And you can see there's been 6 primary work groups that have been active in helping develop that implementation work plan. That's what this diagram is kind of drawing out. And in addition to that, you can see on the bottom row of this diagram, it shows a lot of filter groups that have supplied additional feedback and information to inform those work groups. And if folks on this call are interested in being a part of any of these work groups, please let me know. We're always looking for people to support the ongoing decision making that's occurring as we get closer to full implementation. And this is inviting feedback from the counties, the regions, collaborative groups, systemic work, parent groups, and youth voices. There's a lot of active work going on here. On the next slide, this is where we start seeing the federal definition of candidacy. The things I would highlight and pull out of here is a child who is a candidate for foster care, these are kids who are at imminent risk of entering the foster care system. And what the federal definition is addressing is they're looking to emphasize that they're a candidate if we can maintain a kinship placement, and that the 4E funds can be used to help do that. And this also includes, in the second bullet point, kids who are have adoption or guardianship arrangements that would be at risk of disruption or dissolution. They're also eligible as candidates in the Act. On the next slide, you see a bit further on this. Some of these definitions are very purposely left very broad. So you can see that they were not interested in further defining that phrase candidate of foster care, because they want to leave it for the states to have creative flexibility in who they can apply that to. And you also see in the second bullet point, services can be provided to the child, parent, and/or kin. And they leave the flexibility there for the family also to define who kin is. It could be somebody who's not a blood relative, but functions as kin to the child, youth, or family. If you move to the next slide, this is where we start moving into how Colorado has defined candidacy for the state. And here they want to make sure all kids, this is labeling the desired outcomes for Colorado. We want all kids who need services to be able to have that access, and preferably to be served in the family's home or in a relative's homes to be able to maintain that kinship relationship and support it. We want families to have what they need to stay safe. And we are looking for the system services to be available to them without requiring that they have to enter the child welfare system. So this is still, I sometimes say when we're talking with different groups about Family First, we're kind of building the aircraft as we fly it. Some of the services that we're looking to have and the ability to access them are still not fully defined. And if you were in the work groups, and Catherine, I know, is on the call, and she participates in the juvenile justice work group, a lot of things are still being defined and ironed out, and the specifics determined as we continue to move forward. And there is a Family Digest, a Family First Digest, which is essentially a newsletter that I've given a link to Lily to put on later, but I invite you to sign up for that to hear about the developments in Family First in Colorado as they continue to evolve. On the next slide, this is what Colorado arrived at as their final definition. And we just went ahead and broke this out into 2 slides so you could literally read the full definition. It's for the purposes of Title 40 prevention services, a child is a candidate for foster care when they're at serious risk of entering or re-entering foster care, and who's able to remain safely in the home with provision of mental health, substance use disorder, or in-home parenting services for the child, the parent, or the kin caregiver. Foster youth who are pregnant or parenting are also candidates. And if we could move to the next slide. A child may be at a serious risk of entering foster care based on circumstances and characteristics of the family as a whole, and/or circumstances and characteristics of individual parents or children that may affect the parent's ability to safely care for and nurture their children. That's a pretty vague or broadly defined definition. And again, this is by intent. So for instance, as we move forward, just as a case example, if we identified there was abuse or neglect going on within the nuclear home and the child would be considered for placement, but they were able to look at the extended ecology and be able to find a kinship caregiver who they were able to say, look, we think this child could live in the kinship care home if we could address the mental health needs of the caregiver or substance abuse needs of this caregiver, and that would be safe and provide for all their basic needs. This gives permission for us to apply the definition there and provide services to the kinship caregiver in addition to the parent or the child. So there's lots of flexible options here, and that's intentionally so. If you move to the next slide, this is where the definition of kin, and you'll notice the second paragraph here refers to ICWA caregiver, and that's a very specifically applied and defined definition for the Indian Child Welfare Act. But kin in Family First, in the Family First Prevention Services Act, has borrowed from the definition with the ICWA definition in order to again, support that kin may be a relative, or it can be a person ascribed by the family as having that family-like relationship that I was alluding to earlier with the child, or the person who has a prior significant relationship with a child. So this takes into account, as you see highlighted here, cultural values and the continuity of the relationship that are most significant to the child. On the next slide, juvenile justice candidates under Family First. Family First does apply to juvenile justice system, to candidates who are involved in the juvenile justice system. So that can include any of the involvement that you see listed here. If a youth is involved in pretrial services, diversion, probation, or if they're a crossover youth where they have both abuse and neglect, and they have the juvenile justice legal contact, they can be eligible. And youth committed to the Division of Youth Services are also eligible. Now, there's some fine-tuned things that are applicable here. Once a youth has been committed to DYS, DYS may take responsibility for them, but on entry and on re-entry, Family First still would apply to those youth. So for the transition back home, for instance. In the next section, we move into prevention services. And this is where we're trying to give you kind of a picture of what's coming. In the next slide, you'll see we've already alluded to mental health services and substance abuse prevention. And this is applicable to the child, to the parent, or to the kin caregivers. And in some instances might apply to both the child and the parent, or both the child and the kin caregiver. In-home parenting skill support. So again, this is looking to not require the child and family to have to go to outpatient or placement services in order to get the level of care that they need, but sending services to in-home, and it can also be provided in the community. It doesn't have to be in the home. So there's flexibility with that as well. In some instances, you may have a child who is with a parent who needs to go to a licensed residential family-based substance abuse treatment facility, and Family First will pay for that as well. And then kinship navigator services, this is relatively new across the country. There's lots of work being done in piloting things, and we actually have a kinship navigator pilot going on within the state of Colorado, and I've provided a contact there, or can get you in contact with folks if you're interested in finding out more about the Kinship Navigator. On the next slide, two requirements that the feds are applying here is services need to be trauma informed, and that needs to be both in the way that they're organizationally structured and informing their treatment framework. And you'll see that more as we move into facilities that provide qualified residential treatment programs specifically are going to have a lot of this integrated. Evidence-based services as well. And these, again, are ones that have shown data that shows the level of benefit that they provide to the family. And I'll be sharing, you can see down at the last line here, there is a Title IV clearinghouse There's a link that you'll be able to access to look at what's available currently. I will say this, there's a process for emerging treatment practices that show promise for being evidence-based to be able to make application and be added to that clearinghouse so that there's broader services available as we go. Next slide. Couple things we want to say. There's 3 different levels that have been applied to the practices that you will see on there. They're what we refer to as the promising practice. And these are evidence-based practices that have had at least one study that would have had a quality design and have a treatment comparison group, a placebo group, and they showed that they had better outcomes than that group. Then you have the supported practice, and these are ones that had at least one independently reviewed, well-designed and well-executed random controlled trial. And these had to meet the criteria of showing benefits that persisted at least 6 months past treatment, post-treatment. And then well-supported practice, these are the ones that have the strongest evidence base. These had to have at least 2 random controlled trials and show that benefits from services persisted and were sustained for at least 1 year post-treatment. Next slide. Here's the link, and I think all of you got the slide, so you can always feel free to, this is on slide 23, but you can always feel free later to skip ahead to that and click on either of these to be able to see what they show there. And they're broken out in these same ways, with the promising, the good, and then the well-supported. Colorado's prevention plan, the next slide. In order to claim the federal funding, there has to be the practices that are being supported on that array of services have to demonstrate that they're either promising, supported, or well supported. And this raises some questions because there's going to be some services that may be needed that are not yet on there. And counties always still have the ability to use other funding to continue to provide services if that's what best meets the needs of the child or the family. But we'll say more about that as we go. The state has to prove in their prevention plan that not only do they have those service arrays available, but that there's evaluation plans for making sure that they're following through and demonstrating the level of evidence base that they were looking for. And we'll try and illustrate that in some of the next steps. If you flip to the next slide, you see there's going to be several components. One, the state has to have a plan to monitor that each of these evidence-based practices being implemented with fidelity, and that they have some sort of continuous quality improvement system for being able to prove that. They also have to demonstrate that training is being carried out to supplement those services and support them. And every 5 years, the Colorado and every state is going to have to submit new plans. Now they can submit amendments to that plan at any time. So if for instance, new services were made application to be added to that list and Colorado wanted to endorse that practice, they can always update their plan and submit those amendments at any time to be able to add those services. And my suspicion is they probably will. The next slide gives you a little bit of an example of what the shift in Family First is trying to achieve. There's a service array, or as you see there, prevention services continuum. And Family First is trying to move from having things that were tended to be afterthoughts before as preventative services being seen and used sooner in the process. So where placement used to be one of the primary interventions in many child welfare systems, we're looking to say, how can we move to applying, for instance, in-home services for somebody who we can, for a family where their safety of the children and the family could all be provided if we could just support this parent with parenting skills. That's where we're looking to say, how do we get that prevention service into the home sooner rather than waiting till further down the road. And in these services, the prevention services do receive Title IV 50% funding from the feds. So what that means is dollar for dollar, the feds will match the funding from the state of Colorado for services that are evidence-based and prevention-focused. And I know I've said a lot. Were there questions so far in these things before we move into placement services?
I do think there were some questions that it might make sense to go back and look at.
Sure.
Let me just pull those up quick. I've been keeping a little list. So you mentioned something about the Colorado plan and that it was taking some time, and Barbara Z asked, what are the issues with the Colorado plan? Can you clarify that?
Yeah, but all of the states are, and I work with a state, Casey Collaborative on state implementation. I attend groups there, and I think that's open as well if there's people who might be interested in that. But all of the states are trying to weigh when is the right time to be able to jump in and make the decision on implementing the plan. If the state moves too soon and they don't have enough services in place to make use of the Family First funding effectively, the state could stand to lose millions of dollars in expenses without getting the reimbursement that they're looking for. And so that's where they're still working on, do we have broad enough implementation of the service array that it's going to make fiscal sense at the same time that we're trying to roll this out? What's that break point for where we decide we're going to jump in and it makes fiscal sense and it will balance out? And right now, they haven't landed on a place where they've determined that break point has been reached. There are some things that are being done in a phased in rollout with some of the qualified residential treatment plan program assessments, and I can speak a little bit more to that when we get into the QRTP listing and replacements. But it's basically, when does it make fiscal sense, and we have enough folks with the infrastructure to make this work in place to feel like we're confident in taking that next step.
Touched on this, but another question was, can states opt out of the program, and can you talk a little bit more about what the financial ramifications would be? And just so everyone knows, we will do hand raising too. So if you want to ask your question live, you can raise your hand, and we'll also have more time for that at the end.
Yeah, a great question on that. The opt-in date, as you saw, the requirement for opting in is listed as October 1st of this year. So you can imagine the pressure is mounting for all the states to be able to do that. Although, as a clarification, some states may choose not to opt in. But in doing so, then what it does is it really leaves them financially responsible for any youth who is in placement. So there's fiscal incentives for them to be able to get that reimbursement to choose the opt-in. Now, having said that, there's a lot of states that are probably going to be looking at the October 1st date as the date when they choose to opt in. A lot of discussion in the collaboratives, Casey Collaborative, about how to be able to configure the services and when it makes financial sense to have that move forward with the opt-in. And
then Michelle asked, is there more information about the different work groups? Is there somewhere she could go to see more details, a description of what each of those work groups are and are doing?
Yes, there's a Family First implementation page on the state webpage. And unfortunately, that's not one of the links that I think that I included. But I think if you Google search there, you should be able to find that. And there is a listing of the work group, and there's a calendar that shows when those work groups are meeting. And I believe there's also contact information.
We can work on getting that for the follow-up. And someone didn't get an email. Okay. And then let's see. So this might have been covered a bit, but we have one question about, is there a specific list of what these prevention services are and where we as CASAs can advise families to get them? So I think you started covering that, but I don't know if you want to add any more details to that, John.
Yeah, the current, well, the listing of the clearinghouse is on the website, and there is a map that shows what services are currently available in which counties. I believe that may be accessible as well through the state website, but if not, I can try and dig that out. Some of those maps, I mean, they show what currently is there. That's not showing what applications have been made for new programs in those areas, unfortunately. So I don't know if there's anything that shows what things are in the works, which I'm suspecting that's part of that question, but if not, at least that shows what currently exists.
There's basically a lot of documentation and a lot of information on various websites, and we will work on compiling that and getting it to everyone.
I'm sorry?
Oh, did my internet cut out? I was just saying there's a lot of different websites. Oh, Catherine, thank you. You just posted the work group one. So we'll work on getting that information to everyone. I don't see any more questions for now, but keep putting them in the chat, and hopefully the raised hand feature, I don't see it right now, but hopefully it's there, or you can just put in the chat if you want to ask a question live if you can't find the raise hand feature. So we'll let John continue for now. Thanks, John.
Yeah, this now gets into some of the things that often I would expect are going to be most applicable to you. And that handout that you had a link to from CASA had some very good, helpful summary of recommendations. So with placement, this is where people are going to see some changes with services. And what I'm trying to help create as an impression for you, because I think it's important as we go forward. And Tisa, if you can move 2 slides forward. There we go. The focus is shifting from, you used to hear people say in county casework, well, I'm looking for a bed for this child. And there was much more of an emphasis on placement. And what Family First is trying to stress is we're not looking at placement, we're looking at what are the services that match the level of need the child has. So in this, the way the funding is being reallocated is there's going to still be Family First funding for family foster homes, as you see in that first major bullet point with the 2 subpoints. And there's still going to be funding for kin, certified kin placement. Where there's new Family First funding is going to be for, as I was alluding to, the Qualified Residential Treatment Program. And then there's 3 categories that you see below this in those sub-bullets that really speak to specialty populations. And what's, I think, is maybe a good way to think about this is these are often subgroups that don't have a lot of family relationships necessarily to leverage. So youth who have been survivors of human trafficking may not have a lot of family relationship or kin to be able to leverage here, and they may need, there's still group home funding that will be available for this, for prenatal and postpartum or parenting teens, and then also for emancipation age youth, the 18 years or older who are living independently with supervision. Special funds have been earmarked for those. And I should say this as well, because this usually raises the question, well, what about current group homes? And I think that's in our next slide. Well, this is first, the QRTP is a brand new level of residential that's been created, but it's also got a high intensity of service applied to it. And in order to be for youth to go to those services, they have to be assessed and to make sure that actually meets their needs. And those QRTP, again, it's going to follow the trauma-informed treatment model. They do have medical staff available. Nursing and clinical staff have to be available 24/7. They may not have to be on site, but they have to be accessible. And there is a state licensing process and national accreditation process for this. And I can tell you as an update, I know that there's been at least 4 facilities that have made application for this. To my knowledge, they haven't been licensed or nationally accredited yet, but they're in the works. On the next page, you see some of the requirements for those QRTP facilities. They have to have family members involved in treatment, and they have to maintain sibling connections. The data has been very clear that that's one of the things that has been most supportive to youth in care and helps with maintaining kinship connections. And then there has to be the ability to provide aftercare for at least 6 months post-discharge. Now that may be something that's subcontracted, but there has to be the availability of those services. That then leads to the change that I was alluding to in the next slide. This is where federal reimbursement is going to go away for the specialized group homes and for the group centers. And also for residential child care facilities if they don't become QRTP providers. To my knowledge, the 4 facilities that I mentioned before were RCCFs that have made applications. And I know there's more in the works. They just haven't completed that application process. So if they're interested in being a designated qualified residential treatment provider, they need to make sure they meet those criteria. Some of the limitations is they can't have more than 16 youth present in that facility. So that represents a big change for some providers who have made application, and they're in the process of adjusting their business models to modify it to meet these requirements. Next. The assessment that I mentioned, the CANS assessment, is listed here. That's the Child and Adolescent Needs and Strengths tool. And some states have been using this. I know Boulder County uses this, and there's a couple others who have used some similar tools for assessing. It's a very behaviorally specific assessment tool that is used to identify what are all the things that we see as needs in a multitude of different sub domains, if you will, and also to look at what are all the family and ecological strengths that we can leverage there. It's completed, as you see in that first bullet point, by an independent assessor. And this is somebody who does not have any, is not associated with the Colorado Department of Human Services or the county. They will be evaluators who are designated and qualified to conduct the CANS assessment by the Administrative Service Organization. There's 5 different ASOs within the state of Colorado that manage regions of the state, and they're the ones who are coordinating this. If you look at the next slide, there's a couple of key points we want to make sure we emphasize here. Prior to referring for this independent assessment for QRTP, the caseworker is still going to follow the regular county design supervisory process to screen for that approval of appropriateness for the QRTP placement. So they would assess this family using their red team, their supervisor, manager, and or administrator approval, if that's what their county structure is. And they would refer a screened in case for assessment to the Administrative Service Organization that I was mentioning prior to or no later than 1 day after placing the child in a QRTP. So to just give an example, if they had a safety need occur that was significant enough that they said, you know what, we need this child's, in order to address their safety or basic needs, they need to be in this level of care. That's where they do have the ability to make an emergency placement, but the timeline would be that they need to make that referral for the independent assessment no later than 1 day later. And then from there, the next slide, then the ASO and the independent assessor have 10 business days or 15 calendar days from the time of that referral to complete that assessment and approve it. And that includes a court report being submitted. And I'll show a sequence in just a minute that gives you kind of a visual listing of how that would flow ideally. Part of that is there has to be a family and permanency team meeting that occurs somewhere between that 6th and 8th calendar day in order to meet the timelines for that court report to be submitted. And once the child or youth does enter a QRTP level of placement, every 90 days they'd have to be reassessed. And that can be conducted by an evaluator who's been trained in the CANS from the QRTP facility. On the next slide, this is in some ways, this is very simplified, but you can see moving left to right that this is a sequence ideally that would flow. So as soon as the county or DYS requests that QRTP placement and they would initiate the independent assessment, then you see it's listed as an IQI. This is what I was calling the evaluator or independent assessor. They interview the youth and the caregiver. And they also, you'll see the arrows that indicate it goes to the next box where they have collateral documentation. This would include previous therapy providers, GAL input, things from courts, probation, schools, extended ecology, people who are stakeholders in the youth life. And that might take them back to repeat or extend some of the interview with the youth and caregiver to make sure they have an accurate completion of the CANS assessment tool. Then they complete their assessment narrative and itemize out all the levels within the child and adolescent strengths and needs. And that's brought then to the family permanency meeting, where those are reviewed and there's a collaborative discussion about what best meets the child's needs, the current needs. And those recommendations then are, as they're discussed, it may change some of the recommendations that were initially assessed by the independent assessor or the independent qualified individual. They then add that to any changes or revisions to that plan, and that gets submitted to the Office of Behavioral Health, which then checks to make sure that it meets all the requirements. There's the fidelity review that then there's actually another step here. It gets sent back to the county, and then that final report is then submitted to the court. And you see in the bottom line, the guesstimate on those timelines. So you have up to 8 days for those first 5 blocks to occur, and then 2 business days to make sure that the court report is finalized, it meets all requirements, and is moved to the court. And I'm assuming that the CASA volunteers would fit into that 3rd block among the other folks who are involved as key stakeholders in the child's life, child and family's life. Does that make sense? So then just to flesh some of this out, I know I'm moving through this quickly, but I'm just trying to make sure we leave some time for questions. The next slide. The court involvement, some of the things there, the court has to determine and approve the QRTP placement within 60 days and find that that placement provides the most effective level of care. And then later on, the Administrative Review Division will conduct a 60-day review to assess that. And it should be noted, I think that's maybe showing up in the next slide. No, that if sorry, I got ahead of you there, Tisa. If somebody disagrees, there it is in the asterisk bullet point at the very bottom. If the professionals do not agree on the placement, there's not consensus. The statute requires the case to be heard in 30 days. So this might be where special advocates, court-appointed special advocates might say, I have a different opinion, and you can initiate that kind of administrative review within 30 days. On the next slide, just a couple things to highlight here. There are two tribes in Colorado, the Southern Ute Tribe and the Ute Mountain Ute Tribe. And to my knowledge, they have the ability, they're among the 574 recognized, federally recognized tribes. They have the ability to create their own Family First program directly with the feds. They also have the ability to opt in with the state of Colorado. So I have not heard updates as to where they stand with that and what their choice may be. There's a special concern here, as you see in the third bullet point, and this came out of our American Indian and Alaskan Native work group, because of the disproportionate number of American Indian and Alaskan Native youth. They're 2.4% of the youth in foster care, while they're only 0.9% of the US population. And that seems to match some indications in national standards as well. And if you look at the next slide, what's important here is Family First builds on ICWA. And like I said, some of the Family First concepts and philosophy has been borrowed from ICWA. It gives the opportunity to comprehensively support those, as well as to be able to provide culturally sensitive and customized services for youth and families where there's out-of-home placement or they already have involvement with the child welfare system. The whole point here is that Colorado is looking to keep the families together and improve those youth outcomes with supportive services. And if you look at the next slide, there are services that are specifically designed and evidence-based with Indigenous populations. And I know that in discussions in the work group that we've had, those services have been looked at and are being discussed as options to add to the array of services that would be available. And the point there is wanting to make sure those are culturally responsive to the families that we serve. We added this slide to make sure we're emphasizing one of the key points of Family First is to make sure that if there is any tribe or tribal affiliation for the youth or suspected, that the child welfare workers are working very early to engage the tribes and tribal communities for that youth, because they're the most valuable resource in being able to support them. And those family engagement meetings should involve folks from the tribe being invited at the outset to make sure there's adequate time for them to be able to attend those as well. Some of the implications in the next slide. We do have with the Indian Child Welfare Act that applies to all of the federally recognized tribes. There may be children who do not fall into that ICWA designation, but there's still the emphasis in seeking to keep them connected with family and kin and tribal involvement at every level there. And it's also important to know that those youth who are ICWA eligible may also be considered candidates just under Colorado's candidacy definition. So even if they don't meet the ICWA definition, they still are eligible for all the things we've talked about previously for Family First as candidates. And the next slide. Family First does recognize here we want to just highlight that much of what we see evolving in Family First that's going to benefit all families was derived from the early work in ICWA. And then on the next slide, this is where we started shifting into just some things that are CASA specific. This is that resource that I mentioned. If you haven't read through that, it's well worth a read. I myself learned a lot that was very helpful in being able to highlight some things for you as we went along that are synchronized with CASA recommendations that are available in that document. So that's worth accessing after here. And then I think the remaining slides give contact information. Here, what we wanted to identify, this training is often used as kind of a catalyst for larger discussions. And my hope is that each of you will be able to take some of the things as you have time to consider and ponder these, and identify where you would go with further conversations as Family First is implemented. Does it involve you talking with local DCW staff in your region? Do you need to have conversations with local judicial officers or best practice court teams? There's a number of best practice court teams that have been very active from different counties and judicial districts, starting to have some of these conversations about how they're going to implement the QRTP process in their court proceedings. Local providers, who do you frequently utilize or have contact with, and are they making application for evidence-based practices or for the QRTP? Other community members, or even folks from the state, such as myself or other county intermediaries, etc. So hopefully it stimulates some thought. And you heard me allude, next slide, about building the aircraft as we fly it. We love this quote just to help predict for everybody. We know it's going to be messy, and this saying, change is hard at first, messy in the middle, and gorgeous at the end. The states have all had comments about, different aspects of Family First implementation that have been more challenging, but everybody is pretty excited at the benefits and the improvement of services that this is providing for families. So I hope this is helpful. And then there's a page of resource links, and I've added some of the updated ones and even my contact information. Feel free to email me if there's some resource that you need specific access to. I hope that's helpful.
Very helpful, John. And we do have a bunch of questions coming in.
Yes.
So we'll get to those. And then, yeah, we do have some folks in the other work groups too. So maybe we'll give them a moment as well after. Maybe we'll do a couple questions to just introduce themselves and tell us a little bit about their experiences on the work groups. But first, I wanted to go to this question from Barbara. So Barbara, I've asked you to unmute. I don't know if you see something that you can click. There we go. Okay. If I can find you.
Okay, I think can you hear me?
Yes.
Okay. John, I'm not trying to be the negative Nelly in the group. I guess what confuses me, or where I am not seeing the level of forward movement that I'd hope to see at this point, is that we still are tremendously dependent on the county intervention system that's based on a crisis approach. Something happens that is so dangerous or so egregious that the county has to step in to prevent further harm to a child. The earlier warnings that have often led up to this, the calls from the school counselor, the report from a neighbor, the observations in a school setting, they get phoned in because they're all mandated reporters, and they just get time stamped and we go forward. That seems to be where the prevention opportunity is, and yet our system just doesn't seem to get there at all. We're still waiting on the 15th call to the hotline, not the first or second call to the hotline. how are we planning to back it into the prevention stage?
That actually, I was looking at some notes from the Casey Collaborative, and that's actually what all of the states are wrestling with, but some are being more specific with that. Especially as you start talking about when can we get to the point where they don't have to have involvement with the family, with the welfare system to be able to voluntarily access services. And that gets tricky because there are some, you know, if the family can voluntarily say, you know what, I think I need some in-home help because I'm really struggling with my parenting, or I'm struggling with substance abuse or things like that. There has to be that both the level of insight and willingness to and readiness for change to be able to step into that. To go back to your question with the counties, I would say, because we're talking about, we've got some phase 1 rollout counties who are going to be trying out this QRTP process. And I was just in a call yesterday as I'm developing the training for their county staff, where they're still trying to wrap their minds around how do we implement this? How do we get to where we can be responsive enough and agile enough, I think, to be able to respond and apply preventative services before they reach the point of things being emergent. And now we have to look at something outside the home as the way to address that safety need. Having said that, I've actually was an observer on a CANS assessment call with County of Boulder, who was able to safely maintain the youth that we were discussing in that call in the home, with making sure they had adequate services to address the mental health needs of the youth, some of the parenting skills of the parents with supportive services. So I know it can get there, but you're seeing some of the growing and maybe even the bleeding edges of this as we're trying to move in that direction. I know that's not a satisfactory answer, but we're all moving. You know, this is where counties are all trying to wrestle with, how do we get to that place?
And if you don't mind, John, I might add on to that. This is
Oh,
Ashley
please.
Chase.
I saw you on the call, so please. And Ashley has done a number of the bench card trainings as well about the QRTP process for judicial staff. But go ahead.
Which we will be doing for CASA in the next couple weeks. So that'll be great. So I am Ashley Chase with the Office of the Child's Representative. And as John said, I'm involved in Families First implementation team. I've been the co-chair of the implementation team for the last 2 years and involved in several of the smaller work groups. With regard to the prevention and backing in, I think in Colorado, we already actually did quite a bit of this. We laid some groundwork for it because we had, through 4E, opted into the waiver program so that we could, some of this is not as new in Colorado as it is in other states, believe it or not. But what we've seen as we've started doing this work is that there are already some organizations completely changing the way in which they do business to have this more prevention model. We have residential treatment facilities that are now completely changing the way they are thinking about delivering services and trying to come in on the front end and trying to keep kids at home and trying to be more prevention oriented. A lot of the work started with families that are touching child welfare because that's quote unquote the low hanging fruit, although it's the most difficult low hanging fruit of all time. But there have been a lot of talks about then how you keep getting prevention further upstream. And so the implementation team has intentionally had other entities involved other than child welfare. So community partners, people from different agencies that aren't typically at these meetings. So it's been much more robust in the planning to try to make sure we're thinking more community minded. So the next step is really how the community prevention assets we have in Colorado can be brought into this work. And they're working on that now, how you identify it, how you match them up, how you keep confidentiality, how you make sure they don't enter child welfare. So we have the right people at the table to do that, which is nice. And there's been conversations, particularly like between healthcare policy and financing, which is like Medicaid and child welfare, in ways they haven't been able to communicate before. So it's been really exciting to see.
And I'm seeing a greater demand too, just to add on to that, to facilitated conversations to do exactly what Ashley was saying. that so many of these systems were operated in kind of a siloed capacity, and to get them all discussing how this is going to look as they collaborate together to configure these services, prevention services being offered sooner and easier.
Thanks, John. We have another participant who's raising their hand. So I want to let Susan ask a question. And Tisa, I don't know if you want to stop sharing so we can see the gallery view again, and we can spotlight the people who are asking a question.
Yeah,
Thanks.
thank you.
Perfect.
Hi, I'm Susan. I've been a CASA in 2 states, Delaware and Pennsylvania, for about 15, 16 years. I have had, I don't know, 15, 20 cases in the 2 states, and everything from teenagers to babies. And also I've been an educational surrogate parent for in Delaware for kids in foster care who have an IEP. And I have also been a teacher for 30 years, and I've had many kids who have had babies or been the daddies of babies, et cetera, et cetera. I do agree that families need support, but we need to specifically talk, or you need to specifically talk about single parents, particularly teenage parents who don't have much support. And also, I'm a little concerned about your comments about the comments about treatment center placement. I recently have had a case where the mom was in a treatment center and wanted the child with her. And the treatment center said, there's no way, we don't have any, we have nobody here to take care of this child while mommy is doing whatever she needs to do. And also addressed abandoned children where the parents just disappeared and there is no family, there is no support system. And they're with a foster family or foster to adopt family, and they're in the best place that they can ever be because mom is never going to get this kid back.
Yeah, and I hope that came across clearly, but if not, there is this special designation in Family First for the pregnant and parenting teens, the single parent. And that designation too, for the child to be able to be with the parent or kinship caregiver or whoever in a substance abuse treatment facility, that's still in the growing phases as well. So it's not surprising if there's facilities that currently exist that say, hey, we don't have capacity to be able to take the parent and the child. But I think that we're going to see some of that as facilities say, you know what, we want to convert from being a group home to a facility that actually provides this kind of care.
If the parent is in the treatment center and the child that goes to school, you're going to move the child from school A to school B.
Yeah, I can't sort out all those are. Yeah, I agree with you. Those are really tough circumstances, and I think that's where assessing what's in the best needs of the family is still going to be part of that county assessment, the child welfare, to say how do we have those family engagement meetings to make sure we get the right or best configuration that we can get. And it's not going to take the place like you identified with abandoned children. If they're at a foster care home through the county, if the abuse or the neglect warrants and there's no other family resources, kinship relationships to leverage there, you're exactly right. That will be the best placement. And the county still has to make those determinations county by county and child by child.
I think the child by child is the important thing.
The other thing to remember, Susan, with Families First is that prevention doesn't just mean for the child and their parents. Prevention under Families First means for anyone who may be caring for that child. So that actually enables, Ken to get prevention services to help keep a child in their home and make sure they're not like needing a higher level of care, or if they had a higher level of care, to have enough supports to get them back into the kinship home. Foster families could use that, to prevent them going up to a higher level of care and coming back. So prevention is much broader under Families First than we think of it now.
And there's one thing I skimmed over in the points that I should probably add here as well, is the child and family may be a candidate, and if they're approved, they can get the prevention services for up to 12 months. And then after that, if they meet criteria again, they can have extensions of those services for as long as they meet the criteria and it's warranted. which could conceivably go for years if that's what meets the needs of the child.
Thank you,
Good.
Susan, for asking those questions. I want to go to a couple other questions we have
Sure.
in the chat. So we have one question about how do we see the role of CASA evolving with the anticipated or hopeful success of Family First? And then there's a couple follow-up questions that I'll get to in a minute from that person. And John, you can please chime in here, but we also might want some of our
I was going to say, I'm
CASA
hoping to
folks
find
to
out
chime
from
in.
you all how you see this changing things, because I really can't speak as clearly to that. Are there others who want to address that?
Well, I could take a stab at it to start with, and then we can hear from CASA themselves. But, you know, it's not like we're going to stop having dependency and neglect cases. I think the idea is that it would significantly reduce because you'd have some prevention and you wouldn't have people coming back. But unfortunately, we're never going to get to zero. So I think for CASA in particular, you know, I work for the Guardian Ad Litem Agency, so we're on every case. So that affects our bottom line a little differently than I think for CASA, where we still aren't able to have a CASA on every case. So I think as far as caseloads and numbers, if I were CASA, I don't think I would be concerned, because you know, maybe you'll just get closer to being on every case if the case numbers reduce. I do think it would be really interesting for CASA to spend some time thinking about how CASA could take a more prevention role, because I do think that, you know, some CASAs I know provide services. That's not necessarily the CASA model, but, you know, around the state, people do things differently. And when you think about some of these prevention services and some of these community services, I think some of those would fit really nicely in with CASA's mission and values. So I think there could be some opportunity there as well. And then, you know, I think when it comes to the cases that are in court, again, thinking about prevention in a broader way and making sure that like the family is getting the prevention services and the kid, and you know, just kind of helping the courts and professionals involved think about that whole picture might be really pertinent for CASA.
I would assume that, I know at least in Jeffco, Gilpin counties, we do have CASA volunteers working with the parents, with the child still in the home with the parent, and that we would likely be expanding that to offer services, you know, so it's not just children who are removed from the home, and just broadening that way.
Thank you, Catherine. I was trying to find you to spotlight you and I can't find you. Yeah, Josefina and Jenny, I don't know if either of you want to chime in on this too. But I mean, CASA is interesting. I'm not the one to really speak on this, but it's interesting because we're a national organization and then we have the state level and then we have local programs. And I know there's conversations happening on all three of those levels. So there you are, Jenny. So there's a lot of possibility and ideas floating around for sure. Does anyone else want to address that before we go to the second part of the question?
This is Josefina, Lily, and I would also just agree with Ashley. I think there's a lot of opportunity, and what this has done is highlight that opportunity of how do we, instead of having that knee-jerk reaction and all hands on deck when there's a dependency and neglect case opened, how do we support these families ahead of time and provide some of that prevention? And I think CASA as a whole has done some very significant things in the state of Colorado. A couple of years ago, we were added to truancy cases. Again, we know that that's part of prevention. If kids aren't going to school, that usually means something's going on at home. Because we are all separate 501c3s, many of us have dabbled a little bit with the prevention services. I think Pueblo is doing a Safe Babies Court model. Here in Arapahoe County, we are also doing a Safe Babies Court model. All of this is really that wholesome approach of how do we help these families before things are too bad down the road, and then we're figuring out like how we reunify families after they've been split up or those type of things. And I think it was Catherine who mentioned Jeffco does also work with families who the kids are still placed at home, and in Arapahoe, Douglas, Albert, Lincoln, we also do that. So I think every program has an opportunity to really self-reflect, look at those practices that we have in place and how we can better be a part of prevention rather than reaction.
And I think that's consistent with the information I saw in the CASA article that you have a link to, because they talk about also partnering with others to activate services such as health professionals, nurses, physicians, domestic violence counselors, caseworkers, and other advocates. Seems to synchronize with things you were just saying.
Can I add something to that, please? I work with medically fragile children, and a really good partner is the Colorado Children's Hospital. Their social work, excuse me, their social workers have been their whole staff, but their social workers especially have been really awesome, because most of the people there don't know why this child is here in the hospital, for example, without a parent. They know there might be a parent, and then there's the issues of, does the parent have permission to, come and visit the child, who has permission to come, and so on and so forth. So I really have been acting as an intermediary, with the child that I have now, and really doing a lot of education, because a lot of them have no idea what's going on. So, I mean, except they know the health part, but not the other part.
That's wonderful.
Yeah, so we'll go to the next question, but yeah, we're really trying to take a very whole child approach and look at all these different protective factors, which aligns very well with Family First. And we've had some of those discussions with some partners at CDHS too. So related to that, the other part of this question was, here we are. So are there target metrics related to this effort? So I think this is really asking, how are we going to measure that Family First is being implemented effectively? How are we going to track that, talk about that, evaluate it as we move into implementation, or it's fully implemented?
I think there's two parts to that I can think of off the top of my head. There is the Colorado plan, where there has to be data and that continuous quality improvement feedback on the programs that are being utilized by each of the families and the preventive services. And that's ongoing tracking, and the state has trails and ROM data for being able to look at outcomes as they're entered for each family. There's been some questions about, for folks who come voluntarily into services and they come to prevention without having contact with child welfare, will they need to be entered in the trail system? Will we have access to tracking that data? And those are questions that are still being wrestled with to determine what's the best way to go about that. So I don't think they've landed on definitive answers, but others on the call may know more than I. But there will be still the state looking at those, and counties looking at their data that is tracked on those. And that will provide some accountability, and I'm sure the feds will also be looking at those submitted plans and that tracking as part of those 5-year plans.
I think it'll be interesting, John. There's going to be quite a few different data points that, arguably could say that Families First is being successful or not. I mean, I think what we'll see more availability of prevention services across the state. So in some of our service desert areas, that's something that's going to be, I think, directly sort of looked at as they're implementing. So as we see more services available, as we see services available in more areas of the state, as that list grows and our list grows along with it, I think that will certainly be a sign of success. I think we'll see youth and congregate care numbers going down significantly, and youth being served in families and homes. That's data that we currently track. That will certainly be a sign of success. The bill also requires that you have a mechanism to track how many youth are being put into the juvenile delinquency system, because the idea is that you want to make sure you don't have an unintended consequence of implementing Families First and somehow like shuffling kids into a different system. So last year in our state, we passed some legislation that requires juvenile delinquency courts to make certain findings that would say, like, is lack of placement one of the reasons in which they might be committed? So we're kind of laying the groundwork for some of those data points to make sure we can track this.
And I think this also emphasized something you said earlier, is Colorado's been working on this for quite a bit. I remember as we were developing the training, I asked and said, well, how many people are in congregate care right now? And that actually had significantly decreased, I think, in the trainer's notes, and it's in your slides in the trainer's notes. I think it's 174 youth for last year, which was significantly less than what it had been in previous years. So we're trending in the right direction with that anyway, but those metrics I'm sure will continue to be assessed and monitored.
Thank you. Another question I've seen in the chat, phrased in a couple different ways, is just more information about how this will impact cases that are already open. So kids who are already removed from their home, maybe if they'll have more access to some of these prevention services or any of these other, obviously some things about placements. There's some things I think are very obvious, but I think they're asking too about some of the more maybe positive resources that could be available, how maybe they as a CASA could access those, or how the families and children will have access or benefit if the case is opened.
I think that's a complicated question. I think it's going to vary by county and how whoever's helping handle that case. But it should be in general that services should improve, or like Ashley was just alluding to, with your availability of preventative services. It shouldn't be that just because a child's been involved in the system, they would have any less access to, and the family, to the level of services we're describing. And if they are in placement, and that at QRTP level, that they would go through the same assessment process to be able to be in there. And then all the things we talked about with family involvement, sibling contact, aftercare services would still apply. So I think those things would improve. Now, having said that, like Ashley alluded to as well, what about rural areas that have very limited access, or they're so spread out? Are in-home services going to be as available there as in other places? I would say the reality there is that's discussions that need to occur to start identifying what is realistic for this region, or this county, or this region, because it may be that some services are spread across a region or collaborated upon amongst a group of counties is what I think we're starting to see discussions.
Great, just leaving a moment in case any of the other panelists want to chime in. So we're getting close to about 4 more minutes. Catherine, did I just see you unmute? Were you going to add something to that?
Well, I was going to ask John, so this is really about funding though, right? So if a county decides to, in one particular case, pursue a different avenue than Families First because of whatever reason, they're just not going to get federal funding for it. They'll just have to fund it themselves, right?
Right. And
Okay.
those other funding mechanisms, core services and other funds are still available. The state benefits by getting the biggest the mileage out of accessing the federal first funds, family first funds. And I think a question I sometimes hear too is, do those savings get kicked back to the county? To my knowledge, it's still just is the funding savings may occur with the state, but then the state has greater flexibility to decide what they do with the funds they do have.
Okay, thank you.
Well, thank you, Catherine. Thank you, John. Thank you, Ashley and Josefina and Jenny and Tisa for all being here and helping with this today. And thank you for all the CASA volunteers and staff throughout the state who attended. We really appreciate your questions and your insight. And as you can see, this is something that this entire state, really the entire country, is still continuing to figure out, and we're figuring it out as a state. And then within CASA, we're still figuring it out too. So all the questions really just help us continue to learn and reflect. And I'm sure this is going to be a topic that will continue to be training, having at our conference, having at your program, because there's just a lot of different levels and a lot of different, just so many different aspects of it. I need to rewatch it again because I was busy in the chat and I feel like I missed a lot because it was just so much good information. So thank you again, especially John. And yeah, please take the survey. It just helps us know whether or not this was useful. And there's also opportunity to tell us if you have ideas for future trainings. And we do read all those comments, and we're working on building out that calendar. So thank you again. Have a wonderful day. And I think we are done. Jenny put the survey in the chat, and we will email out those resources. Thank you, everyone.
Thank you.
Thank you, everyone.
Stay warm.
Thanks.